Welcome to another edition of the DAMY vlog. My name is Dr. David Duizer. Thank you so much for tuning in. On this show, we cover all things holistic health and wellness related. I am a naturopathic doctor practicing in Vancouver, British Columbia, and the medical director at DAMYhealth.com. In my clinical practice, I focus mostly on the integrative approach to chronic disease management, as well as integrative cancer care. In chronic disease management, we see a ton of cases of insomnia, cases of anxiety. Very often, these people are prescribed benzodiazepines, and because of the patient population, I see mostly people who have a diagnosis, some sort of chronic disease. I see a lot of people who have polypharmacy, a lot of people who are taking many different medications in addition to their benzodiazepines. So I spend a lot of my time managing medications and managing the interconnectiveness and the contraindications that can come about when there is a polypharmacy type of situation. So I've got a lot of experience managing benzodiazepines in the practice here. What I see is the overprescribing of benzodiazepines in general. I think that's acknowledged across North America, but I get why they're prescribed. I get why this situation has come about. Anxiety and insomnia can be very difficult conditions to treat, and benzodiazepines are effective. The tricky thing about benzodiazepines is they increase the risk of dementia. We know they can cause drowsiness, and they can increase the risk of falls and subsequently the risk of fractures, which is awful and really unfortunate. Those numbers are very significant. People do fall when they're taking benzodiazepines. It's quite common. But what is more scary is most likely is actually the risk of dementia, the risk of cognitive decline because of these medications. Now, a recent study just came out this week that said it seems like dementia cases are 5% of dementia cases are caused by benzodiazepines, but there is a modest increase in the risk if we look at the largest trials possible with benzodiazepine use. Now, that's amongst the general population. The tricky thing about this entire situation is benzodiazepines are very, very commonly prescribed to the elderly because they have trouble sleeping, and they occasionally have more anxiety. So people who are already in the age bracket where dementia is a risk are getting prescribed benzodiazepines, and not on a as-needed basis, on a consistent use basis. Again, they're meant to be used in the short term. So what can be done? Well, when you see a holistic practitioner or someone who's practicing integrative or even functional medicine, there are functional tests that can be done to evaluate neurotransmitters. There are functional tests that can be done to evaluate stress and sleep hormones like cortisol and melatonin. So in anxiety, we look at neurotransmitters, but we also look at the holistic approach to anxiety, which can include digestive function and mental emotional support, psychological support. It can include, of course, exercise. It can include a series of things, hormone imbalance. On the sleep side of things, we look at stress hormone cortisol, we look at adrenaline breakdown, and we look at melatonin release. These things should probably be tested, and this is where a lot of the protocols are lacking on the conventional side of things, just because they don't have time or resources to do these type of things. So I completely understand. But on a functional medicine side of things, there is some opportunity for the reduction in medication here. There's an opportunity to pull people off of these drugs. We now know that people who already have dementia, who take benzodiazepines, are at a 41 increased risk of mortality. They speed up the path towards death. If you already have dementia and you take benzodiazepines, it's a nightmare. You really want to look for other solutions. Thankfully, naturopathic medicine has other solutions. Gentle things. Okay, so first, please don't take anything in this video as medical advice. Consult your naturopathic doctor before beginning any protocol. Very simple things we use in stress. Well, number one, I want to mention that I see the value in benzodiazepine use for panic attacks. Panic attacks are awful. Panic attacks should be treated pharmaceutically, especially when they are recurring. If they're chronic recurring panic attacks, we need to be doing something to reduce their recurrence rate, and benzodiazepines work, so I think it's okay. But if it's a chronic low-grade stress, benzodiazepines are not the solution. There are things that are very simple that should be tried first that have very few side effects, such as passion flower, such as rhodiola, such as Siberian ginseng, such as even lavender essential oil can be helpful in chronic anxiety. Treating deficiency, whether it be magnesium, B12, vitamin D even. If there are deficient states, we should try to correct those before we jump to such a medication. We also do neurotransmitter balancing protocols. If it's GABA we need, we can use GABA here in Canada. If it's if it's serotonin we need, we can use 5-HTP as a precursor here in Canada. If it's if it's along a neurotransmitter pathway, we can support these pathways, whether it be the utilization of B12 or B9 or B6, B5 in the production of cortisol. We have a series of tools that we can use in the reduction of anxiety if needed. If it's a high cortisol state, if it's a chronic anxiety state that turns out to be adrenal overdrive, we use things like B6, we use things like ashwagandha, we use things like magnolia. These things are very effective. Phosphatidylserine is effective. These things can really help to bring down cortisol levels. If it's insomnia, there is a holistic approach to insomnia that of course involves cortisol testing, melatonin testing. We have to make sure that the cause is not sleep apnea. If it's sleep apnea, let's move forward with the treatment of this. If everything is okay, then we very commonly will do very low doses of a herbal approach, very low doses of melatonin. We take the levels of melatonin high, we take the levels of the broad spectrum herbal approach slightly high. So basically what I like to do, if everything looks okay lab-wise, is I like to do a broad spectrum herbal for sleep plus a touch of melatonin, a physiologic dose, which is just 0.5 milligram, very low dose melatonin. These things can be very helpful if there's no real cause of the insomnia. Again, with insomnia, we need to divide it into onset insomnia and maintenance insomnia and look at the potential cause, whether it be the difficulty falling asleep insomnia, which is onset insomnia, very commonly associated with high cortisol at night, chronic stress. So this is really why benzodiazepines are prescribed. They work. They call them, but they're GABAergic. So sometimes we can go straight to GABA, and that can be very helpful. If it's maintenance insomnia, we need to figure out, is the body not transitioning properly from non-REM to REM, or is there a high cortisol state but a sufficient melatonin state putting you to sleep, the high cortisol state waking you up when you transition through these phases? So these are things we need to iron out. So that's really what I wanted to cover today. There are solutions to both anxiety and insomnia, and there are holistic, integrative, functional medicine solutions that in certain situations can be just as good as benzodiazepines from my clinical experience. Benzodiazepines are important when they are used as they should be, which is on an as-needed basis. Sometimes sometimes sleep, actually getting some sleep, is more important than mitigating your dementia risk. I totally understand that. And sometimes pulling the mind down from a panic attack is more important than suffering through or trying a naturopathic remedy during a panic attack. I get these uses, but the chronic utilization of benzodiazepines needs to be re-examined, and the functional integrative approach can really help in that re-examine, because when we tie up these imbalances that we experience, whether it be too much sugar, whether it be too low testosterone, whether it be too low progesterone is another one we see. Low progesterone can be a significant cause of insomnia. When we look at this approach, these pathologies holistically, we can find solutions, and that's where naturopathic medicine comes in. Thank you so much for watching. If you like the holistic approach to health and wellness, please subscribe to our videos. We're going to be to our channel. We're going to be doing more videos about topics like this. I want to thank you for tuning in and hope you have a great day.